day, sir. I am Flora Junjunyo and I will be your student nurse for today. So, can I go in the room?
Yes.
Thank you. And I will be closing the door for privacy and performing a hand hygiene. Sir, so today I will be performing a head to chest assessment to you. Sir, can you verify your name
My name is Adriana Torre.
and your birth date?
March 2, 2002.
Your age?
18.
Thank you. So, do you have any allergies?
No.
Are you in pain right now?
No.
So, Mr. Latorre's weight, I did it earlier. It's 52. The height is 1.66 and the BMI is 18, so it's normal. And so he is relaxed right now and has an erect posture and coordinated with his body movement, and his hygiene is good and well groomed and no odor as well as bad breath, and I don't see any signs of distress, healthy appearance and cooperative, appropriate, and he has fast pacing. So, sir, I have some couple of questions to ask. Do you know where you are right now?
Yes.
What is the main reason why you are here?
I'm here for my head to chest health assessment.
What date is today?
February 8, 2022.
So, Mr. Latorres appears to be alert and oriented. So, next, I will be assessing his skin. So, his skin color is appropriate with his ethnicity, and for a pink undertone, and his uniform brown skin color, and I will note it. He has no presence of edema and no visible lesion or abrasion, smooth and dry, and I will palpate his skin. His skin is warm. Sir, can I pinch your skin?
Yes.
So, the skin springs back to previous state. Sir, can you hold your fingernails for me? Thank you. So, his fingernail, the blade shape, he has a convex curvature. Then his nail is about 160 degrees angle, and the texture is smooth, and the tissue surrounding are intact. And sir, can I press your nail? So it returns to its pink color, and it was less than 2 seconds. It was nice and brisk. So next, I will assessing his head. So the his head is round, symmetric, and proportional to his weight. I didn't any notice nodules, also any masses and visible lesions. For the hair, can I palpate, sir, your hair?
Yes.
Thank you. So Mr. Latorre's hair is evenly distributed, and I don't see any visible lesions, lumps, and masses, and it's also thick. And about his face, it is symmetric, and for the eyebrows, it is evenly distributed here. It is intact, and it is symmetrically aligned. And the eyelashes, it is evenly distributed and curled outward. And the eyelids, the skin is intact, and I don't see any discharge and no discoloration, eyelids meet completely, and bilateral blinking. So, conjunctiva, I will pull down your eyes here. So, it is transparent capillaries. It is white, and the color is shiny, smooth, and pinkish in color. So for the sclera, it appears white and clear, and for the cornea, no irregularities on the surface, look shiny, smooth, and the details of iris are visible. And also, the iris is round, flat, and brown, and I will measure your pupils. So, it is 3 millimeters, equally round, and same size usually. So next is for the light reaction and accommodation. So, sir, can you follow this pen light? So, it is constrict. So, sir, I will inspect your lacrimal glands. Will you please close your eyes? Okay, thank you. And so, Mr. Latorre's lacrimal gland has no edema and no tenderness. So, his eyes are both coordinated and parallel alignment. So, sir, we have a test for the eye. Can you please cover your left eye? If there, look at my nose. If my face is clear or there is something blurred.
It's clear.
Can you see my finger moving?
Yes.
Um,
2 point 2 point.
Thank you. Another, your right eye, cover it. Look at my nose again. If my face is cleared or if there's something blurred.
It's clear.
Can you see my finger moving?
Yes.
Okay, and
2 3 point.
okay, thank you, sir. So for the ears, I will inspect Mr. Latorre's ear. If there is any abnormalities. So for the ears, the color is same as his facial skin and it is symmetrical. The auricle is aligned with outer canthus of eye. It's about 10 degrees from vertical, and the texture is mobile, firm, and not tender. So next, moving on, I will be doing a hearing test, which is the Rene test. So I have a tuning fork. So Mr. Lator, which is more louder, position A or position B?
Position A.
Okay, and the next is the test. So which ear heard more loudly and clear?
Both ears.
Okay, so thank you. Sir, I will inspect your nose. So Mr. Latorre's nose is in midline within his body. It is straight and it is absence of swelling and redness, and I don't see any discharge. And I'm going to look up your nose, sir. So the nasal septum is midline and intact. And can you press your nose to the left side? Breathe in, breathe out, and to the other side. So, are you having difficulty in breathing?
No.
So, okay, noted. So, there is no difficulty in breathing, and it is bilateral patency, and there is no also tenderness, and I don't see any visible lesions. So now I have a tongue depressor to inspect his mouth. So Mr. Latorre's lips is pink and moist. The teeth is his teeth is complete. It is white, straight, and aligned. And also, the color of the gums is pink. It is moist, firm, no retraction, and there is no bleeding gums. And for the tongue, it is also pink and moist and has a whitish color. And also the position of his tongue is central and the base smooth. It is have a prominent veins and it is no lumps, no nodules. And also the palate, the soft and hard palate is pink and also intact, and the ovula is in midline. So for the oropharynx and the tonsils, sir, can you say stick out your tongue? So, Mr. Latorre's oropharynx and tonsils, it is pink and smooth posterior wall, and the tonsil is in normal size. It is also pink, smooth, and no discharge, and the gag reflex is present. So next is for the neck and lymph nodes. So I will inspect your neck. Can you move your head from the left side and also the other side? Okay, thank you. And can you swallow? Okay. So Mr. Latorre's muscle is equal in size and it is coordinated without discomfort, and the lymph nodes is absence of tenderness, and the trachea is in midline and the spaces are equal on both sides, and for the thyroid gland there is no visible lesions and masses, and also there is no areas of enlargements or nodules in the trachea, and it is smooth. And so for the thorax, can you move? Back? So the chest is symmetric and it is vertically aligned, and it is full and symmetric chest expansion, and it is bilaterally equal, and his vocal prometheus is symmetric. So sit properly and put your hands on your laps, and okay. When I said exhale and inhale, you should exhale and inhale. Inhale, exhale. 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 So, Mr. La Torres, posterior thorax is normal. So, for the anterior thorax, I'll palpate it. So, it is quiet, rhythmic, and effortless respiration. The temperature is warm, and it is bilaterally equal. So, it is flat sound on the part with heavy muscle and bony prominences. So, back to the trachea. I will use this stethoscope. Inhale, exhale. Inhale, exhale. Inhale, exhale. So it is normal. The sound is bronchial and tubular. And so for the aortic, inhale, exhale. For the pulmonic, inhale, exhale. And for the apical, inhale, exhale. Herbs. For the herbs or epigastric area, inhale, exhale. And lastly, for the tricuspid, tricuspid, inhale, exhale. So, all are normal. It is louder at that location. And next, I will use also the bell. So I don't hear any sound. And wait. So his apical pulse was 65 and it's normal. So for the carotid artery, I will palpate. So it is smooth, rapid upstroke and slower upstroke. And I will use stethoscope. I will use the bell. Inhale, exhale. Inhale, exhale. So no sound here, so it's great. And also the jugular veins. Inhale, exhale. Also no sound here, so it is normal. For the breast and auxiliary, so his breast is rounded shape, slightly unequal size, and generally symmetric. It is light color because of less exposure, evenly pigmented, no swelling or any lumps, and the areola size and shape is also equal, round, um, symmetric dark brown, and has no also lesions. And the nipples size and shape, it is also equal, round, and inverted the same direction. No lesions, no tenderness, and no discharge. And for the auxiliary, it is absence of masses or nodules. So next is for the abdomen. As what I inspect, the skin is unblemished, uniform color, flat, rounded, and no sign of enlargement in the liver or in spleen. It is symmetrical contour. The vascular pattern is not visible. And for the vowel sound, okay, so the vowel sound are normal. So I will palpate your abdomen. How does it feel?
Okay. Good.
Okay, everything's feel good. So lastly, I will be assessing the musculoskeletal system. Muscles and the bones. For the joints. So the muscles is bilaterally symmetric, no contractures, and no tremors, even and firm muscle tone, and it is 100 muscle strength. For the bones, there is no deformities and no edema or tenderness in bone. And for the joints, there is no swelling, no warmth, redness, and absence of tenderness, swelling, has smooth movement, and lastly, no nodules.